Thank you everyone for being there, and I'm very pleased, and it's an honor for me to be there. I would like to thank everyone for inviting me, and I will be the second vet of the day, so that will change you a little bit from everything you say already. But I think that as Antonio showed, that we get something to share and we get something to discuss together. The purpose of my presentation will be just to describe the use of the internal brace in small animal surgery. Internal brace is mainly used in dogs in the stifle to improve rotational instability in hyperlax knee, as Antonio showed to you. And also I do believe that to decrease the risk of meniscal tear after TPLO. But in my end, I also believe that internal braces could be a good opportunity to protect any meniscal repair after a TPLO and after a knee injury. That's just why I would like to share with you these cases with it, Charlie. It's a 22 kilograms dog with its mixed bred dogs, but he's coming to me with a grade 4 right hind limb lameness. That means that it's very painful. The lameness started very few days ago. At the orthopedic exam, you can see that we get a kind of huge instability with a hyperlax knee. The X-ray show acute tear ligaments of the cruciate ligaments with synovitis. Very few or minimal osteoarthritis, very sign of instability. That means that we are in an acute tear of the cruciate ligament in the dog. In the arthroscopic examination, we get a kind of chondromalacia of the tibial plateau, even of the femur. But if you look at the meniscus, when you are going to palpate it, there is a kind of more horizontal tear into the meniscus, which is not a very big tear, but it's starting to be starting. And I do believe that it could be a problem if I let this tear untreated. So I try to, first of all, we go to a meniscal repair with an inside-outside technique with some spinal needle to stitch of PDS suture into the meniscus to try to hold this beginning of horizontal tear. Then I move to a TPLO plus an internal brace to avoid any internal rotation and to protect the meniscus and to protect also the meniscal repair. This is a post-operative X-ray with the TPLO plates. The post-operative tibial plateau angle was fine, and the stifle was fully stable in all the position. During the follow-up, I get no lameness at 2 months follow-up, and as a follow-up for the meniscus, as we get the TPLO plate, we didn't get any very beautiful imaging with MRI on the post-operative follow-up. So I do try to do some ultrasound, and the ultrasound show no abnormality of the meniscus on the stifle, and at 6 months post of the dog was clearly full level of activity without any lameness. We were quite happy with the results. So I would say that as the internal brace decrease internal rotation in the knee of the dog, that will protect the medial meniscus, and I do think that it's clearly mandatory in case of meniscal repair in dogs. And a very recent study show that in dogs, if you do only a TPLO on top of the meniscal repair, you get more or less a failure rate of 30%. But if you add to the TPLO an internal brace, you decrease the failure rate of the meniscal suture until more or less 7%. So I do believe that internal brace on top to increase the outcome of the TPLO for a standard TPLO also increase the results of our meniscal repair, even if meniscal repair in dogs is clearly less frequent compared what we've done in human being. And also some cases because we were in an ankle surgery motion, ankle surgery discussion. So just a small injury of a tarsus in a cat. That means that we got very small patient. This patient gets a road traffic accident with complex disjunction of the right tarsus with some fracture of both malleolus, and on the left side he gets sprain of the medial collateral ligaments also. The right side was treated by external fixation plus osteocentesis of both malleolus. The external fixation was left on the cat during 6 weeks to protect the repair of the malleolus. But on the left side, you can see that there is a partial tear of the collateral ligaments, which was repaired with some PDS, very small one, 4.0, and then I protect the repair with a kind of internal brace. At that time, I did not get the very small bone anchor, and on top of that, the fibula of the cat is very, very small, so I do prefer to treat it but just by bone tunnel and some button, just like more or less with a tightrope. And at the end, I get some quite good result with this cat because, as you see on the postoperative follow-up, the function of the tarsus is quite nice. I'm sorry for Gordon because the video is less sexy than yours, of course, but it's.
My wife likes it.
But it's, we are quite happy with the result with the internal brace in tarsus, even in a very small dog, a small patient like that. So I do believe that internal brace in our practice, it's very interesting to increase stability of our stifle or even other joint that will protect repair of the collateral or protect repair of the meniscus. And I think that which is the same than you, I think that it could also, by increasing stability, decrease the postoperative immobilization. For the cat, I just let us light bandage for 2 weeks, no more. So that means that in our case, which is sometimes difficult to get some postoperative immobilization, it's very interesting because we get less complex postoperative care. And of course, at the end, I do believe that decreasing immobilization improves patient outcome. So I would like to thank you again for inviting me. It was a great pleasure, even if I was a little bit scary to speak in front of all of you. Thank you so much.